Infectious disease diagnostics require multiple layers of information. Does this patient have an infection? What kind of pathogen is causing the infection? Which drug would be the best choice for treating it? Even though infectious and non-infectious disease processes can produce similar symptoms, they are managed quite differently, and the consequences of failing to distinguish between them can be life-threatening. Understanding the host's response to infection can help fill this gap. In the past, antibiotics were not seen as a patient safety issue, so they were prescribed even if there was little or no indication that they were needed or evidence that they were helpful. We now know that decades of consistent overuse of antibiotics contributed to the emergence of antibiotic-resistant infections, and yet we continue to see these drugs overused by as much as 40%. This diagnostic uncertainty makes it critically important to offer tests that can quickly determine not just whether an infection is present, but whether that infection is bacterial or viral. MeMed-BV is a host immune response assay that helps accurately distinguish between bacterial and viral infections in just 15 minutes. When doctors have this information, they are in a much better position to improve the way they prescribe antibiotics. I recently heard an example from a hospital physician in Massachusetts. He was caring for a 60-year-old patient with a history of COPD. She came to the hospital with symptoms that were nonspecific: mild aches, fatigue, fever, chronic cough. These could easily be tied to a viral condition, but the physician ran the MeMed-BV test. It was actually his first time ordering it, and it came back showing high probability of bacterial infection. The patient was ultimately diagnosed with bacterial pneumonia, and the physician shared with us how glad he was that it helped him catch the bacterial infection so he could prescribe appropriate antibiotics. Fungal infections can be hard to diagnose. They're slow-growing organisms. They can be challenging to recover from clinical specimens, and the medications that target them often come with significant side effects. Rapid identification of fungal infections would enable more targeted antimicrobial decisions and improve patient outcomes. Today, diagnostics are getting faster, and there are more automated tests and tests that work directly from patient specimens. These methods are expanding to multiplex tests that allow doctors to detect all pathogens that might be in the differential for their patient. I am particularly hopeful that a deeper understanding of the host response to infection will lead to faster recognition of infections,